The insight that was sparked for me as a, I guess, a representative of patients and carers or caregivers is that the culture has shifted, the mindset has shifted for people now. I think healthcare is requiring that we as patients take more responsibility and accountability for our own health, which means becoming more educated, learning to ask questions, to partner with our health providers, be that our primary care physician or any other supports that we receive if we're suffering from chronic conditions. And I think that that was a really big insight for me. To have it confirmed, because I suspected it, but didn't really. But based on the conversations and what I was hearing from my colleagues today, that's what I found. In view of what I heard over today is probably a summary of each of the healthcare segments or sectors, summarizing what the challenges are for each of those. And then I believe looking at involving the patients and their carers in developing solutions. Because as recipients of the care, we're closest to it. We experience the whole healthcare system as a system, whereas the providers are providing it based on a silo. So it's hard for them, understandably, to be able to identify what the barriers are, because they make assumptions of what might be going on in another element of the health system. But the patients and the caregivers are experiencing it real time. And you find that there's fragmentation, and I think if there was more patient input and that conversation, dialogue between the healthcare, various healthcare silos and the patients, this is imminently solvable. And I think that's one of the ways that we approach a solution or solutions. And it'll be ongoing. I mean, this is all about continuous improvement, because we know once the bulge of the baby boomers, that's going to pass over the next whatever number of years. So the health system will continue to need to evolve. You know, it is the way it is because of circumstances that dictated it should be this way. So we're going to have to, as circumstances change, continue to monitor it and look at it for how well is it serving the needs of the population, and really being sensitive to that and on top of that.